Welcome to surgery at MidState.
Robotically, we're doing mainly the same surgeries we were doing before.
I'm able to perform hysterectomies, remove ovaries, remove cysts from ovaries, treat endometriosis, remove scar tissue, basically all the same things that I was doing before that might perhaps have required larger incisions. Now I'm able to do with a more minimally invasive technique.
The advantage of the Da Vinci system is that it allows me to do these large procedures through very small incisions.
The incision on an open hysterectomy, if done like a typical C-section scar, would be about this big. If it were done up and down, it might be from the pubic bone to your belly button. And the biggest robotic port is probably about 1 centimeter, so about this big.
We're able to do a lot more complicated surgeries with smaller instruments and smaller spaces.
There is definitely a misperception in the public about robotic-assisted surgery, and the feeling that the robot's doing the surgery while the surgeon himself or herself is just sitting having a cup of coffee somewhere.
Though the surgeon is not directly at the field, he's always got the control.
The surgeon is directing the robot how to perform.
There are 4 arms in total, 3 robotic arms and an arm that the camera is attached to. Once the robot is docked to the patient, the surgeon then sits down at a console.
When you're actually inside the console controlling the robot, you're seeing everything around you as if your eyes are right there, as if you're doing an open procedure.
This console has both hand controls and foot controls.
They're basically extensions of my fingertips, and you put your hands into small pincer handles, and you can open your fingers like you would tweezers, and it moves the ends of the instruments.
It's a very natural movement.
You're able to go around corners, see around corners, hold tissue in a particular way.
It's my surgical skills magnified by the robot and in fact enhanced.
The console also gives us an advantage of high-definition 3D visualization.
If I'm doing an open surgery, I'm only limited to how close I can get because of the sterile field versus pulling up the magnification on the robot, so what I see is 100 times better than even open.
There's huge advantages to this type of surgery. There's far less pain. There's less chances of blood loss. There's less chances of infection because we're working through so much tinier incisions. The patient's safety is dramatically improved through these type of procedures.
Certainly if you can avoid at any time a large incision, the benefit is in terms of recovery for the patient.
They respond very well. They're up and around earlier. They recover very quickly, where they feel like they still didn't have surgery.
They generally have less pain, require less pain medications, are up on their feet much quicker, and are also back to work sooner.
With the old open hysterectomy, you were looking at 6 to 8 weeks recovery. Now we're having patients heal as fast, from a comfort level, heal as fast as a 1 to 2 week period.
One of the biggest teaching points for us when we're counseling patients for robotic surgery is that they are going to feel so good that they have to remember that they did have a major surgery.
The advantage of having a robot here at MidState allows the patient to get treatment in the comfort of their own community.
One reason to come to MidState over another place would be the experience that the surgeons have in utilizing this equipment.
I am very pleased with the care my patients get here.
But more importantly, you would want to have your surgery performed here due to the staff that's here. The ability of the staff to make patients feel at ease in what can be a very troubling and scary circumstance is truly a gift.
We're all working for a more effective team approach to the patient.
I think we're bringing something that's very new and innovative to this area, and patients should feel comfortable that they can receive that care at this center.
Over 300,000 cases are being done by open surgical methods in this year. There is no reason for virtually any of these 300,000+ cases to be done open anymore.
If a woman's been told she needs an open abdominal procedure, I would say she needs a second opinion.
No woman should have an open incision placed on their abdomen anymore when there are the techniques and abilities for women to have these same procedures done through minimally invasive techniques.
I think the biggest thing I would say to patients who are considering robotic surgery is don't be afraid of the technology. You're in good hands.